Tusonga mbele mama Afrika, Afrika, Tusonga mbele mama Afrika, Afrika,
Honorable Prime Minister Kassim Majaliwa, distinguished East African leaders, ladies and gentlemen, our dear youth, good afternoon. It's impossible to create a better world without bettering the lot of women. The world cannot be a better place if women's conditions are not better in it, wrote Tajuddin Abdul Rahim, and may his soul rest in peace. While these words were penned in 2006, they still resonate now despite our country's advances of the past 15 years in granting women equal status, equal opportunities, and equal protection under the law. Perhaps the greatest indicator of how much further our fight must take us is the fact that discussions on female equality are still being held, and justifiably so. And still in view of the cultivation and employment of female potential that must be achieved to reach our 2063 development goals, greater efforts must be invested.
Muhimu tunahitaji kujituma, kujitoa, uadilifu, uaminifu ili kulijenga taifa aminifu. Na hasa vijana mnaposhiriki kwenye matukio mbalimbali ya uzalishaji mali, wale wazee wenye umri wa kati waendelee kuwa na matumaini makubwa na vijana ambao ndio nyie.
Today I'm joined by my fellow
Diana on this Gender Equality Forum.
Yes,
we are very excited to have you in this engagement.
Actually, we need support because it is not very easy, especially the younger you are, the more difficult it is for you to even get into these spaces.
Introduce our next speaker, who is Laura Bass. Okay.
Yes.
So Laura, as the Dutch Youth Ambassador for SRHR and bodily autonomy, how can we support you by connecting with youth from across Africa to ensure broader outreach and impact?
The best way to help me is to make sure that young people can participate actively in society. My name is Laura Bas, I'm 25 years old and I'm the Youth Ambassador for Sexual and Reproductive Health and Rights, Bodily Autonomy and Gender Equality within the Ministry of Foreign Affairs. In one sentence, my job is to make sure that the voices and needs of young people from all around the world are represented in the policies that the Ministry of Foreign Affairs make.
Do you think climate justice component is strong within the Action Coalition's commitments?
When we talk about, for example, why Africa is going to be hit the hardest by the crisis, we must acknowledge why that is. So this requires us to address legacies of colonialism, imperialism, neoliberal capitalism, and how these manifest and affect our ability as African people to self-determine in these economic global systems that are built on hierarchies and that centers profit over people.
So from your perspective as a young woman, how do you think we can organize ourselves to position young women at the front line for the Action Coalition's agenda?
First and foremost, young women can start by popularizing the commitments that were made during the Generation Equality Forum. If given a chance, young women are definitely able to come up with very innovative ideas that would aid the government in rolling out and advancing the implementation of the commitments in their communities.
Hello, welcome Africa to another episode of You Lead Unplugged. We are very glad that you've decided to spend this evening with us. We are winding up Women's Month. So let me just say first, before anybody else, hello to all the women who are on this Zoom. You can give us a little wave or raise your hand using one of those tools in the Zoom panel just at the bottom of your screen. We just want to say hi. We want to say hi. So welcome once again. My name is Fiona Kemigisha and I am the host of You Lead Unplugged every single Thursday. It's a space that we created for us to be able to talk to you guys, a space that's interactive, conversational. This is not a webinar. If you've been here with us before, you know this is a space where you get to speak as well. So we have some really great guests that are joining us this evening to discuss something that is very near and dear, which is empowering women in our health choices. And when we talk about that, of course, the overriding factor is sexual reproductive health and rights. So we're going to get into that conversation. But first, please feel free to let us know who you are, what you do, where you're tuning in from, right in our comment section, and we'll say hello. I see there's already someone here. Hi, Kasera Ogola. Programs Director at Lake Region Women Health and Equal Rights in Kisumu, Western Kenya. Welcome, and welcome to Shamsa as well. I see you. Hi. Guys, please feel free again to let us know where you are. I should probably tell you where I am as well. I am in Kampala, Uganda at the moment. So yeah, let's just jump right in. I'm going to first let our guests introduce themselves, tell us a little bit about who they are and what they do. So let me start with you, Sunshine. Please go ahead and let us know who you are and what you do.
All right, thank you so much, Fiona, for having me. Hi, everybody. I'm also joining from Kampala, Uganda. My name is all there in the description. My name is Sunshine Fiona Komsana. I would really like to drop my Fiona name in the spirit of decolonization, but soon. I am an African feminist lawyer and writer. I work, that is not who I am. Who I am is I'm a person. But I work with Akina Mama Africa, which is a Pan-African leadership development organization that works in several African countries, but is headquartered in Kampala. And I work as the Program Associate for Sexual Reproductive Health and Rights. And I'm very excited to be here. Thank you so much for having me.
All right, thank you so much for that introduction. Let me let Lillian as well introduce herself. She is our second guest this evening.
Hello, everyone. As introduced, my name is Lillian Sospita from Tanzania. Hope everyone is well this evening. Looking forward for the youth vibe on a topic that is really into my heart. So I work with Voluntary Service Overseas as a youth engagement project assistant and also a Women Deliver Young Leader, class of 2020. So glad to be here. Looking forward for more.
All right, thank you so much, Lillian. So our guests, as you have heard from their short introductions, are people who work directly in the field of women, in the field of SRHR specifically. And that's actually where I want us to start, because I never want us to jump into conversations assuming that absolutely everybody knows what this means, or maybe that you even have a full understanding of it. So the first thing we're going to get into is, what does it mean? What does sexual reproductive health and rights mean? What does that encompass? So let me start with you, Sunshine. Maybe you could give us, our audience, maybe there are some people who don't really know what that encompasses, what that really means. So just your take from your experience, from your expertise. What is SRHR? Oh, sorry, you're muted. We can't hear you.
You would think that after 2 years of Zoom, we have figured it out. Sorry about that.
It happens.
So I was saying that, thank you so much. When I saw this question, one of the things that I tried to think through what sexual reproductive health and rights means, but then I was like, this is such a big, it's a very heavy phrase. So I went and really just relied on the definition of sexual reproductive health and rights that we use in our work, which we borrow from the Gutma Lancet Commission report. It's very comprehensive, and in the ways in which I'll speak about it, I think we'll all have a good understanding of what sexual reproductive health and rights are. I can link the report in the chat after I'm done explaining this, but just really sexual reproductive health and rights is a state of physical and emotional and mental and social well-being in relation to all aspects of sexuality and reproduction. So it's not really just a merely of or the absence of disease. I know that a lot of discourse around SRHR is rooted in talking about disease or prevention of disease, or really treatment of disease or service delivery in order to curb the effects of disease. But sexual reproductive health and rights really is also about those aspects of sexuality and reproduction that are not just merely about the absence of disease, but also the positive aspects of sexuality and reproduction, such as pleasurable sexual relationships, and really how that can also is an integral part of human beings, and is also so much a right as is other things, right? As is other aspects of our sexual rights. So it's also really about the individuals, our individual rights to make decisions about what happens to our bodies, and also to make those decisions from an informed point of view. And so really achieving sexual and reproductive health relies on the realization of rights. So the rights are an important part of us realizing what health is. So without the rights, then it is very hard to achieve the sexual reproductive health and rights outcomes that we seek, and that are rooted in our sustainable development goals and all the other markers of development. So what some of those rights really under sexual reproductive health and rights are, I've talked about bodily autonomy and integrity, the right to personal privacy, that the right for someone not to be all up in your personal space, to freely define your own sexuality. And I know this is contentious, but also it includes defining including sexual orientation and gender identity, deciding whether or not to be sexually active. Those rights also include choosing your sexual partners, choosing to have sex and to have safe and pleasurable sexual experiences, deciding whether to marry or not to marry and whom to marry. That decision for that is all also under sexual rights. Then also deciding when and by what means to have a child, whether you're going to have a child through adoption, whether you're going through surrogacy, or through the carrying of pregnancy, and then also just really having access to lifetimes of information and resources, because at different stages of our lives we require different kinds of resources and kinds of so an adolescent, for example, has different kinds of needs in terms of services and information than, for example, a premenopausal woman or a child who has not yet reached their puberty. So it's really all of those things, and to say that they are sexual reproductive health and rights are an essential part of our universal health, but also like our rights as individuals. And it's also in the spirit of Women's Month, they are also a very important part of ending discrimination against women. So yeah, that's really my long explanation about what sexual reproductive health and rights is. And yeah, I'm happy to further unpack it as we continue to speak. Thank you.
All right. Thank you for sharing. That was very comprehensive. I really wanted all of us to have that realization that it covers more than just what you said. It's not just an absence of disease, it's bodily autonomy, it's choosing, it's being able to choose what happens with your body. But you pointed out that very important thing, that not just choosing, but choosing with the relevant information, having the right information, quality, information that really helps you make the right, the healthy, the most wholesome decisions for your body. So, which is one of the things that we're really going to get into, because access to that information is so vital. So I'm just going to read a little bit of something that I came across on the UNICEF site about the state of SRHR, and it says that in developing countries, more than 20 million girls and young women aged 15 to 19 have an unmet need for modern contraception. Globally, approximately 3.9 million adolescent girls risk their lives every single year undergoing unsafe abortions. And it's such a huge number. Like, you think about those millions, it's not even hundreds, millions of girls and women going through these things. And I think I'd like us to, since especially because it's Women's Month, I'd like us to talk about how women and girls are affected disproportionately when it comes to the inadequacy in how we are protecting our SRHR, how we are providing this information, whether they can access it, So let's just talk about that. Because you guys work again in the field, both of you ladies work in that field. Maybe you can share with us, Lillian, a little bit about how women and girls are being affected disproportionately, that women and girls are being affected on a wider scale, and in what ways, so that we can just really look at what are those specific things that are making the need for this so much bigger, even when it comes specifically to women and young girls. Lillian?
Hello?
Yes.
Yeah, so the matter of SRHR, a lot of people leave out the STI part because we are mostly focused on the pregnancy, but there's STI diseases that young people are very shy to them, and they don't have information at all. So I just wanted to add on the definition of sexual reproductive health. The STI is very important. For young people, must have a knowledge on what is STI, how can you get it, and how can you get a treatment after that. So backing on the question, so lack of information and poor service on SRHR is affecting women and young girls. First, I'll speak on the young girls, especially in most of the country in Africa. When someone gets pregnant, she cannot continue with school. So for a young girl, not having information or access to the sexual reproductive health services, it means she will make an informed decision and in the end get pregnant. We can see the rates of pregnancy are very high. So after getting pregnant, it's most likely she will not continue with school unless she hide it, of which most of them are not successful. So after pregnancy, then all the dreams are now dead. So she become a mom, and becoming a teenager mom in African context, it's very hard because you become dependent. Most of them lost their economic freedom because they'll depend on either on the partner or parents. So it become an economic burden to the community and family, and also it also lead to the chances of violence for the young women, young girls. So maybe she can do a lot of things to gain economic independence, of which most of them end up on a violence, like violence from partner or close relatives. And also, apart from that, mental health. So the whole lack of sexual reproductive services bring a young girl into a lack of good state of mental health, because she'll be worried most of the time. If she has a partner, she'll be worried, I'm going to see my partner, what if I get pregnant? What if I get AIDS? And she doesn't know where to get the information. Sometimes they have a place they know where to get the information, but they're afraid because the the services are not friendly. So number one, I would say the dreams of young girls are being denied because of lack of sexual reproductive health, and also the mental health state for young girls is being affected as a result, and also the economic of our community and the young girls. So it also decreased or affected. So, and speaking of example of the project, I did a project, it's her story, our action. So we were capturing stories of teenager mothers. So all of them were under 19, but you can't believe some of them had 2 kids. They don't know how, they don't have anything to do, like any economic business. They're not going to school. They're just staying at home, depending on the family. And there was this girl, she's staying with her grandmother. She's just 18. So she started involving herself on her sexual matters when she was 14. And then she was raped several times without any condom or any other thing. So she had STI. She went to the hospital and the doctor told her, like, in order for me to treat you, I must sleep with you. And the doctor slept with the lady, and then she ended up pregnant and she had a kid. She doesn't have anywhere to go. She doesn't have any business. She has nothing for a kid and her to survive. She's just in a total stress. So like those are the few examples from the community. Like we have a lot of young girls who are being affected by the lack of sexual reproductive health information or being denied their rights. Yeah, so speaking on women, effect to women, I think the biggest effect is having an unplanned pregnancy. So like most of the women have their second child or first child not planning because they don't have right information about some, because of a lot of stigma around contraceptive, like if you use them, they'll make you won't have a kid and all that. So most of women end up getting unwanted pregnancy, which it affects their everything, also mental health, I would say, because like imagine having to go through abortion where you could have used a contraceptive to stop it in the first place. And also the economic part, so like they can't plan children or space the children. So like when you have unplanned pregnancy, so you can't plan how many kids, you can't have control on that. So at the end of the day, you end up spending a lot on raising children, your time and money. So it affects also the economy as well. So that's it from me.
All right, thank you so much, Lillian. I think you really brought out those things, those things that are, that are tipping the scales, which is the case in so many areas of life. The things that are tipping the scales against women and girls, specifically with regard to SRHR. So let's get into one of the big issues, which is access. And I just want to first remind our audience that this platform is very interactive, so feel free to put up your hand and you'll have an opportunity to weigh in on the discussion. It's really not just us talking, we want to hear from you guys, so please feel free to put up your hand and I'll make room for you within the conversation to be able to share. So now another major thing we really want to discuss is access, because access is, it's up there. When you talk about SRHR, if we don't have access to the information, if we don't have access to the services, then, this whole SRHR becomes practically a myth, whether for all of us. So let's just talk about that access to good quality, age specific. And I know both of our guests have touched a little bit on that, about age specific, that it's different for prepubescent women and girls, then adolescents, and then a woman who is menopausal. It's very different. Their needs are very different. And so we want to talk about that access. And I know that Lillian raised earlier when we were talking outside this platform she talked a little bit about like the impact of COVID-19 on that access. But before we get into that, let me ask Sunshine to share a little bit about her experience in the field of SRHR when it comes to universal access to quality age-specific SRHR to be able to live fulfilling lives and all of that. I just want to hear like your thoughts, yes, but also what that looks like on the ground, at least from where you worked. I know it's very different in different communities, but what that looks like, where are we failing? Do young people, young women and girls in this context have the access to that good quality information and services? Please go ahead.
All right, thank you so much. Thank you so much, Fiona. When you talk about access, I can't help but access to SRHR, I can't help but think about patriarchy, right? And think about the ways in which like society has situated women and in that kind of like in the social hierarchies whereby women's ability to even access SRHR services is usually tied to how they relate with men, right? for a lot of women, for instance, and for a lot of health centers in this country, women cannot access contraceptives, for instance, without permission from their spouses, right? And also for young people, for instance, we still have an uphill battle around comprehensive sexuality education. The Ministry of Education continues to fail to provide guidance on how sexuality education should be taught in schools. Comprehensive sexuality education should be taught in schools. So then what happens is there is misinformation. So children are learning from other sources, because obviously children are going to, in either ways, children are going to learn about sex. They are going to be curious. And so in not having the right information, then they make the wrong choices. So there is, in terms of access, that there is that layer around information, but then there's also the layer of patriarchy in the ways it prohibits women and girls from being able to access services. But also there's the, I don't know who has feedback in there. I don't know, is it from my end? I keep hearing.
Let me mute on my end and we can try and see.
Sorry. So I think that, so there is the inaccessibility of information, then there's the added inaccessibility to services, but then also this country and Africa as a continent has an unmet need for contraceptives, and that unmet need continues to be deprioritized because all of our African governments, most of our African governments have very limited resources allocated to health. And so we find that a lot of for example, family planning, contraceptives, all the SRHR services, and it's usually maybe from external funding. You talk about the Global Fund, the World Health Organization, all these development partners that give our government resources, or even the products themselves. And as I know we're going to have a conversation about COVID, but as the pandemic set in, and governments that usually fund our health sectors were also grappling with their own health crisis in their countries, we saw a shortfall. And as we will see, there is a very big crisis right now of teenage pregnancy. In fact, this conversation is so timely because UNFPA yesterday released their flagship report of the state of the world. It's called the State of the World Population Report. And it's specific this time, it's titled, I think, Seeing the Unseen. You know, that they're talking about the crisis, the ignored crisis really of teenage pregnancy because of all those barriers to access. So I think that we cannot, first of all, continue to bury our heads in the sand around policies towards addressing access to information, but then also we cannot, our governments cannot continue to not it disproportionately affects women. Sexual reproductive health and rights issues disproportionately affect women because women are the ones that carry the children. They are the ones that are most affected by a lot of the STIs that Lillian was talking about, but also they bear the brunt of childbearing and also a raising of those children. So I think that the issue around access of affordable, accessible, quality SRHR services and commodities is still a really big issue for us. And I think the other thing I didn't speak about in terms of access is then access to legal and safe abortion. And most of our governments in Africa have criminalized access to safe abortion. And the thing that criminalization of safe abortion does is criminalization of abortion does not prevent abortion from happening. It just increases the risk of death and other fetal complications that arise from having unsafe abortions. It usually just punishes the poor. So if you are a woman with means, you can actually walk into a health center and you can acquire a safe abortion because you're willing to pay the money to do it. So women who don't have means then go and use very clandestine and very unsafe abortions and abortion methods, and then they die. Africa has the highest rate of mortality due to unsafe abortion. In Uganda, I think more than 60% of maternal mortalities are from unsafe abortion. So really, there are so many layers to access, and I think we have more problems than we do have solutions. But I wanted us to really contextualize where that is coming from. And also to say that women are not the same, right? So women are not a homogeneous group. There are women with disabilities, for example. So when we talk about access for women with disabilities, that's a whole other layer. Health centers are not equipped the infrastructure at most of our health centers is not constructed in such a way, for example, for women who have physical disabilities. We don't have a lot of SRHR information in Braille for women who are visually impaired. We don't have sign language interpreters in health centers. And there is this
Okay, I think we have a bit of a freezing situation here. I don't know if it's just me that can't hear you properly. Maybe you guys can let us know in the comment section. Can you hear Sunshine? Okay. Sunshine, we're having a hard time hearing you. I think our network is breaking up a bit, but what we can do. Okay, I see someone saying no. Can you guys hear me? Oh, okay, all right. I think we had a problem with our connection with Sunshine, but I'm sure she'll be back. She touched some very important things, especially about abortion. I think it was such a strong point when she said that abortion laws against abortion don't actually prevent abortion. You know, they just lead to more and more deaths because of unsafe abortion. Oh, okay, I see Sunshine is back actually. Sunshine, maybe you can try and speak and see if we can hear you.
Oh, hi. Someone called me and I was using my phone for hotspot. So I dropped
no
it.
worries.
Sorry. Yeah.
No worries. You can maybe conclude what you were saying as well.
I don't know at what point I dropped off. Could you tell me what was I talking about?
So you I think you were talking about abortion and how, no, actually you were talking about how women are not homogeneous and how this thing really has layers. You know, it's different for women with disabilities, for example, and so on. That's what you were talking about when we broke off.
Yeah, so I was speaking about how when we talk about access to SRHR, and the fact that women are different women have different needs, and I was just specifically giving an example of women with disabilities and how most of our health centers from which SRHR services and commodities are required are supposed to be accessed, for example, the facilities are not built in such a way that, for example, if you have a physical disability, you can access it. Most of them do not have ramps. You will find that most of the information is not translated in Braille for women who are visually impaired. But even for women who are not visually impaired, but women who are illiterate, you will find that a lot of material, and like this also alludes to the fact that a lot of it comes from the Global North funding partners is in English, and there hasn't been a bother to translate it into local languages. But even in translating it to local languages, there are people who are just illiterate, they can't even read. And that's majority of our population, right? And also you'll find that for women who, for example, have a hard of hearing, it's difficult for them because health centers don't have sign language interpreters. So this just, and as speaking about the fact that about the misconception around, for example, women with disabilities being asexual or not having SRHR needs. And so we have like the issue around access has to be unpacked in all the ways that it needs to be addressed on the basis of the kinds and the categories of women that we have, and especially putting emphasis on the fact that when we don't address all of these issues around access, we are leaving the most marginalized behind, who are majority of our women and girls. So yeah, I think that's the point I was trying to make before the internet.
All right, thank you so much. I think you've hit a lot of really important points. The abortion thing really stood out for me because it's so true that laws against abortion don't actually prevent abortion. For the most part, they actually lead to more unsafe abortions and a higher mortality rate, which of course will affect the women who are the ones that who actually carry these children. But let me also give Lillian an opportunity to share her thoughts when it comes to access to quality SRHR services and information in our communities. And before she contributes, I want to remind the audience again that our space is really open and interactive. If you have something you'd like to share, please feel free to put up your hand and I will carve out some space for you to weigh in, to comment during the conversation. So let me let Lillian come on board and just share a little bit with us about access. Lillian, are you there?
Yes.
Okay, go ahead.
All right, so I think most of the services are there, but when it comes to access of the healthcare providers. So like in most of the health centers, they have contraceptive, they have information about reproductive health.
I think, Lillian, we're having a hard time hearing you.
But when they use
Lillian?
that room to access the service or information. Yes. Can you hear me?
Not very well. I was thinking maybe you can switch off your camera and then try using the audio alone.
Okay, sure. No, yeah. Hello?
Yes, I think it's better now.
Okay. So I was saying on the issue of access to good quality sexual reproductive health information and service. From my point of view, the information and the contraceptive are there. It's just on accessing them. Especially for the youth, when they go to the healthcare centers to ask for the information or contraceptives, it's the attitude of the healthcare providers that makes a lot of youth not to go and access those services. For example, you might go there. How old are you? You're 16. Why do you want that for? You're a prostitute. You have started sleeping with men around. Hey, I'll tell your mother. So, such issues, they make young people not go to the healthcare centers to ask for information or to access the services. So like it's very worse when young people is now pregnant and go to the health center. She start being judged, and also when she want to access the abortion service or advice or procedures, it also even worse. Like now you have been a prostitute sleeping with the men around, and now you want to abort to offend your God, So it's very stressful.
Okay. I think we have lost you, Lillian. We can't quite hear you anymore. But you guys can also can let me know in the comment section if it's just me. But I can't hear Lillian anymore. So what we can do for now, perhaps Lillian, you could try to exit and then come back, and hopefully sometimes that helps. But again, you guys can let me know if you're hearing her or if it's just me. Okay, I think it's Lillian's network that maybe has cut off. All right, I think she'll join us again when she has an opportunity. There was a hand up, but it seems to have disappeared. Don't be shy.
No, it's
okay.
It's up, yeah.
Okay, I see a hand up from Malieta Mboje. Apologies if I'm killing your name here, but please go ahead.
Okay, thank you. Can you hear me?
Yes.
Hello?
Yes, we can hear you.
Okay, my name is Marietta I come from Tanzania. I want to add something on the matter of accessibility of healthcare services, particularly to young girls and women. In 2020, I did my research on the awareness of adolescents on accessibility of sexual and reproductive health services. I come to realize that there are some adolescents who have no idea where they will get those services. But also I come to realize that the community attitude toward young girls or toward adolescents services, particularly family planning services. So I say the root cause or the grassroots of the problem is particularly in sub-Saharan Africa, as Tanzania's concern is how community perceive and how community can contribute toward improvement of this situation, because these adolescents are associated with the community. They live with parents or relatives or other social or other community members. So what's the attitude of the community on this issue? It's become like a gap or a question to ask ourselves. That's all.
All right, thank you so much, Marietta. I think you actually even talked about something that Lillian was alluding to before she broke off, the attitudes. You know, how are young people being met? How are we responding to the few young people that are actually able to ask for this help or to ask for this information or ask for the services? And I think that that's a huge factor that has made young people withdraw, you know, be afraid to ask for information, be afraid to you know, say, I need this, because they're going to be met with so much negativity, and especially for young women, because like Sunshine pointed out earlier, our society is patriarchal. You know, if we are being honest, there's a lot of patriarchy in the way we deal with things. Our cultures are very patriarchal, and so young women don't have a chance. You know, you don't have a chance to just be a sexual being without being judged, without being, you know, without having all these impediments. Okay, I see Judy, your hand is up again. Please go ahead, Judy.
Thank you so much. And I want to contribute on the topic by saying that there are a lot of good initiative going back in the ground to ensure that sexual reproductive health is well spread, is well taken care of, but there's something they are missing. And like last year when COVID hit Kenya, there's some specific areas in Kenya whereby the number of teenage pregnancy was very high. And when I was looking at the areas, and I mapped out the number of initiatives going back in the grassroots were very many. And I usually tell people that it's more than distributing a pad, you know, it's more than mobilizing and sitting people down and telling them about sexual reproductive health. Can you hear me?
Yes, we can hear you.
Yes,
okay.
We can hear you.
It is more than mobilizing and distributing out information and distributing sanitary towels, but it's more of finding out what is the problem. And you'll find that this new sexual reproductive health the people themselves, the young girls themselves are the solution, but they're telling you that mostly when we go to school, our school is kilometers away, and we have to wake up in the morning, and at that time we're being raped. And sometimes another thing is that when they are raped, the police station is too far. By the time they're getting to report, 72 hours is already done. when the kind of family they are living. Like, for example, if you live in a four-cornered room, like a single room, and it's only partitioned with just curtains, and you are on your periods, or maybe you want to change your sanitary towels, or maybe you are from the bathroom, your dad is sleeping just partitioned by the curtains, and maybe this, or your brother or somebody else. And you see, these are kind of challenges that really contribute to sexual reproductive health and all the things that comes with it. And especially when you reach out to these young girls on one-on-one basis, sometimes they tell you, you know what, I did not go I did not exchange sex for pad. I was just going through a very tough time during my periods, a very tough stomachache and those cramps, and I was told the solution is getting pregnant. So you find that to me, I think there's not much research done to really see on how to give an effective, sustainable solution to the challenges that teenage girls face. And grants should not be just for initiatives. You just go Bambilas and give. Grants should be, can they pitch a tent, a medical tent, and find out what problem do these teenage girls go through? And just to one last more point is from my own experience. I went to a health facility way back when I was, I think, 10 years, and I had a problem. And when I went to the facility, the first thing the doctor told me is,
Okay, I just want to make sure we can hear each other.
Affecting me. Yes.
Okay,
and
sorry.
that's all I wanted to contribute.
All right, thank you so much, Judy. My internet broke off for just a moment there, but thank you for your contribution. Apologies, guys. Sometimes this Ugandan internet will come for you. But thank you so much for your contribution, Judy. Let me also give Ange an opportunity to share before we head back to our guests. Hopefully Lillian also is able to come back. Ange, go ahead.
Hi, everyone. Thank you so much, Fiona, for giving me this opportunity. And I'm very glad for every contribution from our speakers. It was really insightful and really helpful. But when we are talking about the accessibility to services, I also find it warning that some of our policies and laws are still not really accommodative, and not actually some, but most of them. Speaking of that, you will find where we have the accessibility, they are saying that every young person can really access the SRHR services at their health centers, yet they cannot really go there without their parental consent. So which means that I do not find it easy for me to go and tell my mom, hey mom, I need to go and have contraceptives. I don't see it as something easy for any young person to do. So that one really limits the young people, the young women here who really needs to get the access to those services. And the same is also the information. We all say that we, instead of having the comprehensive sexuality education being in our curriculum as an issue, we still say that we can still count on our parents to talk to us when we are growing up. Say that we rather say that the parents are going to talk to their kids on sexual reproductive health as they are growing up. But seriously, guys, when they were growing up as well, no one told them that. Few of them had the opportunity to talk to their parents on the sexual reproductive health. Some of them, they do not even understand what we are going through in this generation. We have the access to the technology. We do have a lot of wrong information, inaccurate information. So if we do not have the accurate one as we are learning in schools, we do not expect to have it to our parents who did not even have it when they were growing up. And also now they also still feel shy to talk to their young ones about the sexual reproductive health. So when we have not broke that bridge or that hindrance, I don't find it as an accessibility. We do not have to contradict availability with accessibility. Yes, there are available services, are available, information are available, but the accessibility of those services and information is still a big problem. Yet it's really limiting women and also young people to have the health and have the informed decision, to make the informed decision with their bodies. Thank you.
Thank you so much, Ange. I'm actually glad that you've steered us in that direction of the community and policy, because those are also two things that we want to discuss today. What you really put it well, that availability and accessibility are not necessarily two things that coexist. Things can be available and impossible to access, or really difficult to access, and very different, in fact, for, like we've been saying, for different groups of women, because we are not homogeneous. So let us, you can keep your hands up, ladies and gentlemen. I will carve out some time for each person to speak, but I'm just going to steer back to our guests and get into specifically that issue of community, right? We want to talk about what role the community plays in ensuring that women and girls are empowered in making choices when it comes to their SRHR. I see that Lillian is back now, so hopefully now we can hear you. Lillian, maybe you could try to speak and we see if we can hear you.
Hi, sorry, I had an internet breakdown.
It's okay. It happens to us all.
I'm back now.
It happens to us all. I've seen someone, I see Daniel is saying that he's steamer. Electricity, but no, please, I have power. But there's no, but the network is a bit sketchy. But let me go to Lillian. We're going to talk about the community's role. How can we as a community, we as parents, we as teachers, how can we empower women and girls to have more power, actually, to have more power when it comes to making the decisions that concern their health and their bodies, their sexual reproductive health? What can we be doing better? Even if it's, just us who are on this Zoom, what are those little contributions that we can make to support women and girls more in being able to make better decisions, more informed decisions? What can we as a community do? Please go ahead, Lillian.
Hello.
Yes, I can hear you.
I'm back again. Can you hear me?
Yes.
Yeah, so as community, what we can do, I think, first of all, as the previous speaker said, we have an issue of lack of information and knowledge. For our current generation and the previous one, means our parents, most of our parents doesn't have information about sexual reproductive health. That's why when young people go to the parent and ask about the information, they tend to be very aggressive, because the truth is they don't have information. What can they tell them while they don't have information? So the first thing to do as a community, we need to get the knowledge and be capacitated. So like capacitating the parents so that they can know what really sexual reproductive health is and what are the needs for the young people on sexual reproductive health, including parents, teachers, healthcare providers. For the healthcare providers, they know what sexual reproductive health is and the need for young people, but it's all about capacitating them on how to provide the access and to make the services friendly to young people so that they can access. After the capacity building to the community, then there's an issue of culture. So in our African context, the sexual reproductive health, it is mostly linked with the culture and norms. So it's not okay, or it's not culture friendly to talk about sexual reproductive health with parents, teacher. So there's a little bit of stigma around that topic. So as a community, what we can do is to challenge our beliefs and culture that were favorable back then, but for now, with the current generation, it's not applicable. So like as a community, we have a role to challenge the culture and norms so that young people can access quality sexual reproductive health and rights. And lastly, I would say providing safe space for young people to talk, have a friendly conversation, open discussion without a fear of being judged or anything. So like a safe space for young people to meet and talk about their sexual reproductive health issues and having a right information. Yeah, so that's it. I think that's, as a community, that's what we can do. And the last point about safe space can be in school clubs, maybe establishing sexual reproductive health school clubs whereby young people are supervised by a person who giving them a space, like safe space to talk, ask questions, share their challenges. And also in the community clubs, maybe parents clubs whereby parents meet each other, update each other, and bringing their young people, adolescents, youth, and talk openly without any harsh treatments. And also, apart from clubs, we can have different dialogues, whether in community or schools, about sexual reproductive health matters, so that we can normalize the sexual reproductive health topic. Because right now it's a bit struggle, because it's a topic that is not talked about most of the time. Like everyone is just quiet about it. So if we bring more dialogues, if we bring more school clubs about sexual reproductive health, I think with time, it could be a topic that can catch more attention, and we can hopefully make sure that youth have access to quality sexual reproductive health services. Thank you.
All right, thanks, Lillian. When you talked about cultural norms, cultural leaders, it brought to mind, you guys may know, I mean, she's quite well known, the chief, she's a Malawian chief. Her name is Teresa Kachinda Moto. Oh, okay, I may be saying that wrongly, and I'll sorry. But she is a phenomenal who has stopped hundreds of child marriages and, ensured that girls go back to school, and, just talking about like breaking those kinds of cultures that are taking us back, those cultures that are not serving young women and girls, that are stifling our communities and just are not giving women the freedom or the opportunity to be the people that choose what happens to their bodies or how they live. So I mean, when you see people doing that type of work, I think those are the things that we need to be working towards, normalizing all of this conversation, making it normal for young women to be able to do all these different things. But let me go back to Sunshine. You've been there in the quiet for a bit, but I know you talked a little bit about policy, and I just want to give you also the opportunity to talk a little bit more about those policies. I mean, talk about what we could be doing better when it comes to our leaders and the people who make our policies, the policies that influence what kind of SRHR information we can access and all of that. How do we strengthen those policies? What maybe things have you observed that you think are not serving us, and which things could serve us better when it comes to our policies? In the context of, I know that you're in Uganda, but maybe you've worked in other jurisdictions, or maybe just in Uganda specifically, because I know some of these things cut across. What are your thoughts on that, on the policies, laws, strategies, that affect our access to SRHR?
So I will start, thank you, Fiona. I will start with a disclaimer that policy is not the silver bullet that we think it is, right? And I will say this in relation to a lot of, like, Uganda is one of those countries that has great policies on a number of things, not sexual reproductive health and rights specifically, but things around universal education. And I think we have one of like those constitutions that other countries have to benchmark. So, but policies, having good policy is one thing, and also, but they are not the solution, like the solution that we think it is in terms of addressing all the issues that we have. So I had spoken about how patriarchy plays into women's access to sexual reproductive health and rights, services, commodities, information, and things like that. So I think that one of the core things that we have to do, and especially for young people, I don't think I'm a young person anymore, but for young people, is to be able to, challenge those systemic barriers, for example, around patriarchy, but also around how, governments have, there's a way our government thinks they are doing us a favor, right? When, you can go to a government hospital facility and find maybe perhaps a condom, and the Ministry of Health will take a picture of that and clap for themselves and say, look at what we are doing, all this great work, look at us. And yet we have to link the fact that there is a social contract between governments and citizens, and the government is supposed to provide, these are supposed to be public services, right? And so for us to be able to, strengthen our capacity to demand for more from our policymakers, aside from like written documents that say, decriminalize abortion, have comprehensive sexuality education in place, have all of these things. Right now in Uganda, there is an ongoing around the national school health policy. But just beyond those policies, to see that government is actively investing in public health, because majority consume their sexual reproductive health rights, sexual reproductive health services and commodities from public health. That means infrastructure, it means paying health workers, it means translating all this information in languages that are accessible for people. It means, ensuring that the public health system works for the majority of people. And because women and girls are the biggest consumers of public health, and they bear the brunt of contributing to this economy in a lot of ways, because they occupy the informal sector and pay their dues in taxes and licenses and things like that. We have to make, what I'm saying is we have to make the connection between what we are owed by our governments and what we need to be and what needs to happen. So on the policy perspective, I think obviously there's already work that is being done by a number of advocates. I don't know that there is any particular field of women's rights movement or the feminist movement that has as much resourcing as sexual reproductive health rights work. And of course, a lot of it, as you can see from like the ways it's funded, goes towards prevention of HIV and funding all these male-led civil society organizations that are really just not doing the critical work of ensuring that women receive these services. So I think that beyond talking about like having great policies in place, we also have to, follow the money. Where is the money for SRHR going? If it's not going to women and girls, say, why is this money not coming to services for women and girls? And then continuing to question the ways in which service delivery is done and all those other things. But I also wanted to say that we can't empower. I have like a challenge with the word empowerment, right? Because I think that we can't empower women and girls out of systemic violence, which is what patriarchy has created. So the discourse around empowerment tends to be a very cosmetic solution to structural barriers. When we say, oh, we are empowering women to demand, we are empowering women to, we are empowering girls to speak up and ask for all these things, we are creating a system where, the burden then shifts to the people who are the victims of violence. And so I think that we more and more, and also because the empowerment work has been done for years, and we can see that we are still in the same places, if not worse, in terms of SRHR outcomes. So we have to shift the effort and the resources and the energy towards the people who are supposed to be actually ensuring that women have access to SRHR. So I feel like I've said a lot of things. I probably didn't answer your question, Fiona, but really those are my sentiments around the conversation on policy, on empowerment, and things like that. Thank you.
Wow, no, you 100% went even beyond answering in a way that I feel is going to help us all leave with more information than we came with, which is one of the primary things for us to all get an education in this. And even when you said that policy is not the silver bullet we think it is, it's so important and so true, because policy is one thing, but implementation and, you know, the money, where is the money going, and is it doing what it's supposed to do? Is it serving the communities that it's supposed to serve? Is such a vital thing. I see one hand up, and I want to let this audience member also chip in before we get into the last couple of minutes. Moshi, please go ahead. Moshi? All right. Okay, see your mic is open. Go ahead. All right, I think we are, for some reason, we are not hearing you. And I think it is not just me. So hopefully we'll have another opportunity to hear from you. Could you maybe try again? If it doesn't work, we may just have to move forward. I saw another hand up that disappeared. Moshi, are you there? Okay, let me give the opportunity then to Frederick. I see your hand is up. Go ahead, Frederick. Frederick?
Thank you. Can you hear me?
Yes.
Yes. I would like to give my views on sexually productive health for the women. Most of challenging situation that most of women face, there's no openness between the community. Openness could lead some change. You know, sexually productive health is an adaptive challenge. So the generation has changed nowadays. The generation of the previous is not the generation of the currently that is going on. So the effect of the silence is going to be very large, because our parents are so silenced. They cannot give their views in an open way to their children. So what we need to do on our communities, we need something called openness. We need to open the voices, and sometimes give them learning. And I would encourage civil society, most of the civil societies which are working around the community, to all those who are working in health sectors, they should strengthening the education of the SRH. So for my opinion, the openness to the community is the one of the key role which can play the virtual role to the advocates and mobilize those women on our community. Thank you, Kemi.
All right, thank you so much, Frederick. I think that's something that we've all touched in some way, that the communication, you know, how are we responding to the young women, girls that are looking for this information? How are we making it available? Are we normalizing those conversations? Lillian talked about normalizing. So are we normalizing those conversations? I see one more hand up. That's the last one that we'll have. Shamsa, I'm going to give you 30 seconds to share. Please go ahead.
Okay, thank you. My name is Shamsa Khalfan from Tanzania. I wanted to add up a little bit concerning the accessibility and the challenges that are facing the services to be given to women and girls. Well, I would like to say that maybe it should be implemented that youth should be given access to give information to the fellow youth, whereby youth will be more open when they are talking to their fellow youth, more than when they are talking to people who are older from their age. And also, the education given to women and girls should not be discriminatory. I think men should be given the education too, because I remember one of the training in Morogoro in Tanzania, whereby we collected young adolescent girls and we gave them education, but rather on, when we were walking to our homes, we found some people, the boda people, the boys, they told us, you just give them the education, but after there, when you go, we are going to chop them. So I think if we should give education to male and female in both ways, that equality without discriminating, like giving them 80% girls education and giving the boys education in 50%, it is just like not equality. So, and also I think that education should be available in both areas, whereby urban people are getting more access to education more than the people who are living in rural areas. Also, the people who own smartphones get access to more information than the people who do not get access to smartphones. So I think maybe the training education should go further into the rural areas so that we could bring something which is very equal to everyone. Thank you.
Thank you so much, Shamsa. So I'm going to let both of our guests just sort of sum up in whichever way that they feel is okay. Maybe there's something specific that is on your mind that we didn't talk about, or something you just want to add on as we wind up this episode of Unplugged. So let me just start with you, Lillian. Please go ahead.
Sorry, Fiona, can you repeat?
Okay, I was just saying that as we wind up the episode, I'd like to give both of you, Sunshine and yourself, an opportunity to give us like a closing message. Maybe there's something we haven't spoken about that you feel is vital, or there's something we've spoken about but that you want to add on. Just something that we can leave the audience with, that you can leave the audience with as a guest speaker today. So yeah, please go ahead.
Okay, so what I would say is everyone in the community is responsible to make sure that women and girls have access to sexual reproductive health and rights. And last thing is a call to do men engagement. So like most of the interventions, education, capacity, and dialogue and spaces, they not engage men. So we end up having girls and women who are empowered with the knowledge and information, and then they go back into the homes where men live who do not have such education or information. So it's like we're back to square one. So if we also engage men, give them education, and allowing them to know all things they need to know about sexual reproductive health and rights, it will ease the work, and we can climb the ladder faster. So yeah, that's it.
All right, thank you so much, Lillian. I think I'm now hearing this more, that the men are not as woke as the women, and that there's something to be said there about raising men who are more aware, who are more educated about these things. But let me go over to Sunshine now. Go ahead, Sunshine.
Thank you so much, Fiona. Thank you for everyone who has been listening. I have two things to say. One is just really a pushback around the discourse on engaging men, which I don't like getting into because it becomes a touchy conversation. But I think that in order for us to correct the historical and structural inequalities that have hindered women's access to not just SRHR, but really just opportunities, and we have to be alive to the fact that there is going to have to be more resources and energies towards supporting and helping women, and to ensure that those gaps are closed, those historical divides are closed. And we are very many years away from gender parity. And especially around the discourse on SRHR, women are the ones that bear the brunt of childbearing, of wanted unintended pregnancies, of maternal mortality, of unsafe abortions, and when they do have children, the punishment of childcare, and it comes at a cost to them, for a lot of them, to their goals and to their lives. And so I think that in thinking about engaging men, for people who want to die on that hill, we need to think about tackling things like patriarchy and toxic masculinity, and the ways in which men benefit from a system that is violent towards women, and for them to be able to unlearn that. And I think that work has to be done by men, not by women, because again, women are kind of busy trying to survive, right? And so the other thing the other note I wanted to end with is, there is no liberation for women without productive and health rights outcomes being achieved. There is no sustainable development. There is no achieving our sustainable development goals, or any of the development, I guess, milestones that have been set for us globally, but also at the regional level. So I think that all the work that we do towards liberation of women should incorporate how we improve their SRHR access, and also how we challenge ourselves to think about involvement that I mean solutions that are not just cosmetic, like I mentioned earlier, and to demand, our governments in Africa have made a commitment. They made a commitment in 2001 to allocate 15% of their national budgets towards health. In Uganda, for example, we have never even come to, I think the highest we've had is like maybe 8% of our national budget being allocated to health. And then what happens when governments don't fund health sectors? Then the things that get deprioritized quickly are SRHR, neonatal, maternal, reproductive health services, things like that. And who are the biggest consumers of those things? It is women. So there is no liberation for women without prioritization, funding for public health, and without prioritization of us continuing to ensure that women are the center of this discourse and not men. Thank you very much for having me.
Thank you so much. I think you closed it in a really powerful way. There's definitely, there's a lot to be said there, but we have run out of time, and I'm so grateful to our guests for taking the time to share from your experience, your knowledge about a subject that I know you're both very passionate about and that you've dedicated your work to. So we appreciate you very much, and we appreciate your time. Thank you to every person that has come to join the audience, that has contributed, that has listened and learned something. I hope you found something for yourself, and also something that you can share with somebody else. As we work towards better, for women. Like Sunshine said, we're just out here trying to survive. And that's not a lie. That's not a lie. We really are out here trying to survive. So thank you once again for just being part of this conversation. While Women's Month may be over, life is life, right? I mean, it's a month to just focus on these discussions and hopefully get more attention. But, every day should be a day that we are working towards the betterment of women and girls. So thank you once again to each and every one of you, and have a great evening, afternoon, whatever time zone you're in, have a good that one. And we will see you next week on Unplugged. We're here every single Thursday. And follow us on social media, keep up with our work. We'd love to connect with you over there as well. So we will see you then, I hope. And cheers. Bye-bye.